A new discovery in the fight against breast cancer could offer hope to patients. Scientists have discovered an enzyme that drills holes from cancer cells into bones and could lead the cancer to spread to other parts of the body. In mice, drugs that are currently used to prevent bone loss, like those that treat osteoporosis, are blocking the enzyme. The specialists at Florida Hospital Waterman's Digital Mammography Center explain the importance of mammograms as part of an overall wellness plan for women.
The purpose of the mammogram is to get good imaging to detect breast lesions and breast cancer. It's the first step in trying to prevent breast cancer, because the incidence of breast cancer in women, when I first started medical school, was 1 out of 10, and has slowly progressed to 1 out of 9, and some statistics even show 1 out of 8 women are affected by breast cancer. The way we advise patients to get mammograms is to get a baseline mammogram at the age of 35, and then to get a mammogram from age 40 every year without fail. Despite what other people have said and some other studies, this is proven by both the American College of Radiology as well as the cancer institutes around the world. And actually, women who are high risk even can get a mammogram at age 30. If we find something wrong on a screening mammogram, we contact the patient with a letter, as well as we contact the patient's physician who sent the patient for a mammogram. And within 1 to 2 weeks, they come back for what is called as a diagnostic mammogram. And the diagnostic mammogram can also include an ultrasound, because what we do is, depending on what we find at the time of mammography, whether it's a mass or microcalcifications, we do further specialized views, which include like spot compression and spot magnification views, and we do an extra 90-degree view of that breast. And if it's a mass, we further do an ultrasound, because ultrasound helps us to determine if the mass is solid or cystic. Cystic, 99.9% being benign. If it's solid, then we'll have to pursue next to a biopsy. Now, under the current Women's Care Act by Obama, routine screening yearly mammograms are covered by all insurance companies. So there is unfortunately no excuse not to get your mammogram.
The specialists note that weight gain between the ages of 50 and 60 has been consistently associated with an increased risk of breast cancer after menopause. Fat tissue produces excess amounts of estrogen, high levels of which have been associated with the risk of breast cancer. The battle against breast cancer begins with prevention and early detection. To schedule an appointment and for more information about Florida Hospital Waterman's digital mammography services, follow the Obesity and Breast Cancer story link on our homepage at yourhometownhealth.com.